Hello, my name is Christiana Dykman. I'm making this video today for you to explain craniosacral therapy and how it can be utilized for pregnant women and women who've just given birth, and also treatments for the babies. I got involved with craniosacral therapy a number of years ago when my daughter was presenting some behavioral issues, and my acupuncturist referred me to a craniosacral therapist. At the time, it was profound work, but we had gotten away from it until I had my baby boy last year, and it was a very traumatic C-section. It almost ended up in death for him as well as me. And then immediately afterwards, we dealt with posterior tongue tie, high vaulted palate, and breastfeeding problems. So I was determined to breastfeed, and somebody told me to go see a craniosacral therapist, and I did, and it changed my life forever and got me deeply involved in the work because I already had a great deal of medical background history, and I'm here to explain with you today what it is. So I would say craniosacral therapy is educated, specific, non-invasive touch that supports the body's innate ability to heal. It's very lightweight touch on the body. It's described as the weight of a nickel, and it's done through my hands. And my hands and me palpating you is how I'm communicating with your body, and I'm trying to find the real story of what may be causing pain or dysfunction. So ultimately, the craniosacral therapy restores and balances the nervous system while releasing the effects of stress, injury, and trauma. So the central players during this session are myself and you. I am just the supportive facilitator, and I'm providing the resources for your body's wisdom to kick in. I use my hands to apply gentle pressure and very specific motions. The manual touches are actually tapping into bioelectric and magnetic force fields that are inducing new neural pathways to develop in the fascia and the central nervous system. So what is the fascia? The fascia is a very large organ that connects everything in the body to itself. It is like a shrink wrap, if you will, that is made up of collagen. It's a connective tissue that covers every single muscle in the body and organ, and it's because it's all interconnected. When I'm palpating you in your cranial vault, you can actually feel it in your toes, and these pathways that are working through the fascia are working at the speed of light. So the moment I touch you, I'm immediately influencing through cerebral spinal fluid and the fascia every aspect or every cell in your body, which I find is fascinating. The whole point of the fascia and the craniosacral therapy is to calm the patient and activate the parasympathetic nervous system. So we want to quiet the sympathetic nervous system, your fight or flight system, and go into the quiet one that allows for the body to rest and to initiate its own healing pathways. I've got a couple of pictures to show you what exactly it is that the craniosacral system entails. So we have this diagram here. The word itself means it's named after the membranes that surround the central nervous system and the cranium and the sacrum that you have here at the end. The three main parts are the cranium, which are 22 bones that are in this cranial vault, the triple layered membrane system that's called the meninges membranes. There's three. The outside layer is the one that we most care about. It's the dura mater, or the tough mother. It attaches directly to the cranium bones, and it forms the neural tube that goes down alongside the spinal cord. And the third major player is the cerebral spinal fluid itself. This fluid is, it's a filtrate of the blood. It's actually made inside of the brain in ventricles that are like balloon-like structures that literally take the blood in, make the cerebral spinal fluid, filtrate the blood out, and then dump this into these meninges membranes. So literally when I've got my hands on somebody, I'm working with this hydraulic system of cerebral spinal fluid that's pumping throughout your body at a rhythmic pace. It's almost like a pulsating or a breathing of the skull, where the skull is, very slowly contracting and expanding in order to pump this fluid throughout your body or throughout your spinal cord and your brain. So that covers exactly what the craniosacral system is. And now what I want to talk about is where you actually receive treatment, when you receive treatment, and how you receive treatment. It can be done in any place setting. Ideally, you and me are situated in a tranquil space, somewhere that's quiet and calm, away from screaming kids, if that's possible. You don't have to remove any clothing. I do craniosacral in coffee shops, where some of my patients, they can sit in a lazy boy chair. So it can be done anywhere. It's just with pregnant women, you want a hard surface or a massage table so you can execute the pelvic release and do the inversions that are required for pregnancy. Other than that, it's very simple and straightforward. How often should it be done? Like as often as you want, is often that financial restrictions allow. That's usually the only hurdle that stops people from getting craniosacral therapy is that you have to pay for it, similar to like massage treatment. And this day and age, your healthcare will allow up to a certain amount of alternative medicine that it will reimburse you for. So that can be a perk. But what's great about craniosacral is that when I go and I meet somebody for the first time and get involved and hear their story, I teach them how to do the techniques themselves so they can do it in their own homes, on their own families, and do it to themselves even. So it makes it so it's more readily accessible and available. So the actual treatment itself is just light touches with my finger pads. I work all over the surface of the skull, the face, the neck. I'm working with the frontal lobe, the parietal lobe, the temporal lobe. I work with the occiput or the occipital lobe in the back of your head. I work with the sphenoid bone that's directly behind your eyes. I also work with the ethmoid or volar bone, the zygoma or your cheekbones. I work with the very famous, I always mess this up, temporal mandibular joint, the TMJ. Let's keep it like that, simpler. I work with the jawbones, the hyoid, the SCM or the sternocleidomastoid muscle, the upper, the thoracic cavity, the abdominal cavities. I work with your arms, your legs. And treatment is a full body scope, and it covers not only the light touches, but we work in gentle massage and trigger point therapy if it's needed. And overall, people describe treatment as a gentle massage where they felt like they were maybe floating in space or in a very deep meditative state. And the beauty of the treatment is the more open-minded and receptive towards treatment that you are, the more releases and freeing of restrictions that you will have. So in summary, why do we do craniosacral therapy for pregnancy and for babies immediately after they're born? Well, craniosacral therapy directly impacts how the embryo and the baby are being held in the womb. The techniques used for the prenatal treatments specifically address the pelvic area where so much weight is compressed, causing back restrictions, tendon restrictions, and how the womb is aligned inside. Our healthcare system, has a mother come in once a month to see their OB, and the OB checks your vitals. He monitors the heartbeat of the baby. He takes your weight, which is always the best part, right? He measures your belly. And outside of that, and maybe giving you a few shots and checking your blood sugar levels, the healthcare system doesn't really do much of anything. So when you go in and you have severe morning sickness and you tell your OB, you're severely sick, what can you do? They're like, well, you're pregnant. get used to it. It'll go away. That's not what craniosacral therapy does. Like when there's morning sicknesses, there's imbalances, and we address those. So craniosacral helps reduce morning sickness. It also helps you sleep, which is a must. It balances and realigns the ligaments most associated with pregnancy. So when you go into your doctor and you tell him, you know, my stomach hurts when I'm walking, and he's like, oh, you've got round ligament pain. That's normal. You're pregnant. A craniosacral therapist will say, get on the table. Let's work that out. So the round ligaments, we work on the broad ligaments, the posterior ligaments, and one of the most important ones, the uterosacral ligament. By working these ligaments and working in the pelvic area, treatment prevents premature labor. It helps the baby turn and position itself correctly. And overall, it makes the mom less stressed out during pregnancy, which, you know, science is showing that stress during pregnancy is impacting babies in so many ways, and maybe even the reason for birth defects that are a direct cause of environment. So also craniosacral therapists, you know, once you get your mother through pregnancy, I always recommend that it's crucial for the baby, you know, to have it immediately after birth. 1 to 2 treatments is all they need, since the babies are such sentient, you know, new beings, and they have very little trauma stored in their system. They just open up to craniosacral, and it really helps them adjust after having the birth experience. So it's a powerful tool, and it relieves trauma issues that every family experiences with their birth story. And it's so important for trauma birth issues. Like, so if a baby has been in the birth canal for too long or for too many hours, their head is literally a battering ram that is being pushed against the mother's pubic bone, and they've got to get through that pelvic area and do the dive to come out. So, you know, that craniosacral relieves the compression that gets put on their occiput and especially their temporal lobes. It also helps with any kind of intervention side effects, so your epidurals that you may have, induction, forceps, vacuum, delivery, C-sections, obviously. Epidurals can lead to babies having a very weak sucking reflex. Craniosacral helps renew the removal, or it helps remove the numbing medication, and it can improve the suck reflex. It adjusts malalignments in the jaw and the palate and the cranial bones. It's also, if cranial molding or strong preference to breastfeed on one side is present, craniosacral will alleviate that. And honestly, the best part of treatment is treating the mother while she's holding the baby, because the baby is literally a hitchhiker on mom's autonomic nervous system. So the best treatments that I do is when mom is holding baby, skin to skin usually is what I encourage, on her bosom, and the mother just completely unwinds, relaxes. The baby generally goes into a deep sleep, and problems are fixed just right then and there. So I cannot emphasize enough how important craniosacral therapy is for pregnancy and birth. And as they say, happy mama is happy baby, and happy wife means happy life. So tell those dads out there, having a child is the highest level of functioning the human being will ever face, and you've earned it at this point. You should treat yourself to craniosacral therapy. If you have any questions and you need to reach out, or you want to see more about my story and more about what craniosacral is, you can check out my website at www.balancedbodiescst.com, and the CST stands for craniosacral therapy. So thank you for your time today and for listening. Namaste.